Good day, dearest great surgeons. We are gonna crack together the most confusing 3 chapters in MRCS. Many have been lately discussing the most confusing 3 topics in MRCS. Of course, the almighty stats, the statics, and physiology. Surgeon doesn't like physiology and orthopedics unless you are an orthopedician. Orthopedic will be a great headache in MRCS for you. Like the GIT stomas is a big headache for every non-general surgeon in MRCS. So let's crack together the most 3 confusing chapters in MRCS. We are talking about almost 20% of the exam, because the stats is almost 6 marks from the exam, and physiology roughly 45 questions in the exam with 45 marks, and orthopedics only directly is 7 questions. So roughly we are talking about 60 questions in the exam, which forming 20% of the exam marks. It's a big deal. It's 20% of the exam, and the pass mark in the exam is 70%. So you have be competitor. So what should I do with the stats, physiology, and orthopedics? So let's start with the stats. There's a trick in the stats, because the stats including the audit and medical legal issues, not only stats with its confusing equations. It will be including the consent form, the medical legal aspects, and the ethics, as well as some forms and equation, and of course the consent and the level of evidence. So by studying the normal stats question and reading the frequent records, you will be having at least 4 questions out of 6 marks, if not the 6th mark of all. Most of the exam tend in the stats to repeat the ideas we know, like the type of error, the consent form, and of course the level of evidence. And some equations are not asking about equation and calculating, but the idea, like the type of error and what is this is sensitivity, or this is what is what. So you, by studying only records and frequently reading about the 30 idea we are combining in one note in our group, you will be collecting at least 4 questions out of 6. This is the trick in the stats. Never waste your time in the stats, which is only 6 questions. You can waste your time or invest your time in other worthy chapters, because you will know the question once it get. You will be familiar with it. Don't give it more than a minute to read an idea every day and one. We are now, for example, 1 month away from the exam. What should I do with the stats? Only read 1 question a day. You will get 30 idea, and you will get in the exam at least 4 out of 6, and you will save time for other confusing chapters like physiology. So let's now talk about physiology, the next big deal for surgeons. 45 questions in the exam will be about physiology. What should we do regarding physiology? 45 questions. What should I do? We are talking about 6 chapters in physiology. Each chapter will have about 5 questions. The cardio, respiratory, renal, neuro, GIT, endocrine, all of those will come in the exam, and each chapter of those will be coming with only 5 questions. But you have a trick. In the exam will be including ABG, ECG, Glasgow Coma Scale, and as well as the buffering system of the renal. And the GIT will be asking about the GIT functions and the cells of the stomach. So from each chapter of those, you are getting at least 4 questions you will be knowing before the exam, because in each exam you will be having at least 5 ABG questions and 5 ECG questions and 5 respiratory function questions, either direct about the ventilation or the oxygen dissociation curve, or about ECG or X-ray, asking about the X-ray finding, or the pulmonary embolism. All of these are overlapping questions. So from the cardio, we'll be getting at least 4 to 5 questions from ECG. If not all the cardio will be ECG. In the exam, you will be mastering the ABG, at least 3 to 5 questions from the ABG, which is overlapping between the renal and respiratory, by the way. And guess what? The neuro won't be a big deal. It might be either asking about transaction or a neurological deficit in the spinal cord or brain injury, or ask you directly about Glasgow Coma Scale. And every exam will having at least 3 to 4 questions about Glasgow Coma Scale. Direct question. So don't miss those questions. The ECG signs we are getting familiar with, you don't have to be a medical superior in ECG or a medical doctorate in ECG or a cardiologist. No, the most common finding in the ECG we are getting familiar with in the records and the MRCS we have been discussing together, and you find it in your mock exams. So you are mastering the equations. So this is a big deal about the physiology. You're already mastering it. It won't ask you about the monster you don't know. Don't create your own monster. The exam won't be your monster. Every one of us, if asked to prepare a question or an exam, it will be the monster's exam ever been, because you will be preparing the most points require improvement, but the exam doesn't know that. Miraculously, the exam will come exactly in the point you have studied. And each one of us studied different aspects and different chapters with different points of strengths and different points of weaknesses and different points require improvement. But miraculously, the exam come in the point we know, because as I told you, the physiology 45 questions, you will be mastering at least 35 questions. 5 EBG, 5 ECG, and 5 Glasgow Coma Scale will come in your exam, and you will remember it. So don't worry. The most conflicting and confusing question regarding physiology are 2 or 3, and you know it by now already. So this is the 45 question about physiology, and we talked about the 60 question about the stats. So let's talk now about the orthopedics. We have formally the MRCS stated that 2 questions direct will be about the musculoskeletal problems, and about 7 questions will be directly about orthopedic. So we are talking about 9 questions, but take care. The orthopedic won't be only 9 questions in the exam. It's a trick. So will it be harder than 9 questions? I'm already confused with 9 questions. What can I do if it's more than 9 questions? No, you will know it, because it's overlapping with the trauma and pediatrics and the upper limb. This is the trick, and this is in your side, because if you studied anatomy well, you will be mastering the question of orthopedics. If you study the ideas and basics of the trauma, you will be mastering the orthopedic already. And the pediatric malformation is a must in the exam. So from those 9 questions, you might be lucky enough to be the overlapping question already between the trauma or the upper limb or the pediatrics, like he asks you about the Persis disease or osteomyelitis or even the names of the fracture of the upper limb. He will not confuse you about some things you don't know. So don't create your own monster. Yes, we are talking about 20%, but hope this video made you confident enough to know that you have cracked those 20%. You can do it. I believe in you. Together we can, with the grace of God. Stay safe, and anyone having any question, don't hesitate to write to us in the Telegram group or our Facebook group, and together we can. We are a team. With the grace of God, with all success, these great surgeons.